You know, after spending decades in medicine, one of the hardest conversations I have is when a patient over 70 tells me they feel pressured to keep doing every single screening test their doctor orders, even when those tests might actually do more harm than good. Today, we're going to talk about 5 commonly ordered medical tests that many experts now say you have the right to question, discuss, or even refuse after age 70. We're talking about routine colonoscopy screening, annual mammograms for breast cancer, PSA, testing for prostate cancer, advanced imaging like MRIs for minor back pain, and routine whole body or lung CT scans in low-risk individuals. I'm going to explain exactly when and why refusing these tests might be the wisest choice for you, and more importantly, how to have that conversation with your doctor without feeling guilty or afraid. Before anyone panics, I want to be crystal clear. These aren't bad tests. They've saved countless lives. But after 70, the math changes, the risks shift, and what made perfect sense at 50 or 60 might not serve you well anymore. Let's start with colonoscopy, because this is often the first test where the guidelines get fuzzy after 70. The United States Preventive Services Task Force says that routine colon cancer screening should generally stop at age 75 for most people, and it may not be needed at all after 70 if you've had regular normal screenings your whole life. Here's why that matters to you. Colon cancer grows slowly. If you've been screened regularly and never had polyps or other problems, your risk of developing a dangerous cancer in the next 10 years is actually quite low. Meanwhile, the risks of colonoscopy itself go up with age. The bowel prep can be harsh, leading to dehydration, electrolyte imbalances, falls, and even hospitalization in frail seniors. The procedure itself carries a small but real risk of perforation, bleeding, or complications from sedation. And those risks are higher if you have other health conditions like heart disease, diabetes, or kidney problems. Then there's the cascade effect. If the doctor finds a small polyp, which is very common and usually harmless, you might be sent back for another colonoscopy in 3 or 5 years, creating an endless cycle of procedures for something that might never have caused you a problem. So when does it still make sense to have a colonoscopy after 70? If you've never been screened before, if you have a strong family history of colon cancer, if you've had polyps or inflammatory bowel disease in the past, or if you're experiencing new symptoms like unexplained weight loss, blood in your stool, or a change in bowel habits, then absolutely talk to your doctor. But if you're 75 with normal colonoscopies every 10 years, no symptoms, and other health issues that make anesthesia riskier, you have every right to ask if you can stop. A good question to bring to your next appointment is this: given my age, my overall health, and my screening history, what is my actual risk of developing colon cancer in the next 10 years, and does that risk outweigh the risk of the procedure itself? Another helpful question is whether there are less invasive options, like a stool-based test such as Cologuard, that might give you useful information without the prep, the sedation, and the procedure risks. Now let's talk about mammograms, and I know this one can be emotional, because we've all heard the message that early detection saves lives. And it does, for many women. But after 70, especially after 75, the evidence becomes much less clear. And here's what most doctors won't tell you unless you ask. False positives are common in mammograms, especially as breast tissue changes with age. A suspicious finding leads to a callback, more imaging, maybe a biopsy, weeks of anxiety, and sometimes treatment for a cancer that would never have caused symptoms or shortened your life. This is called overdiagnosis, and it's a real problem in older women. Some breast cancers grow so slowly that they would never become dangerous in a woman's remaining years, but once they're found, the pressure to treat them is intense. Surgery, radiation, hormone therapy, all of these come with side effects. For a frail 78-year-old with diabetes and heart disease, those treatments might reduce quality of life without adding meaningful time. And that's the trade-off nobody talks about at the Mammogram Center. The guidelines from multiple expert groups, including the American Cancer Society, suggest that mammography decisions after 70 should be individualized based on overall health and life expectancy. If you're 72, active, healthy, and likely to live another 15 or 20 years, continuing mammograms might make sense. If you're 78 with multiple chronic conditions, limited mobility, and a shorter life expectancy, the balance tips the other way, and stopping screening becomes the smarter choice. What many women don't realize is that stopping mammograms doesn't mean ignoring your breasts. You can still do self-exams, report any new lumps or changes to your doctor, and stay alert to symptoms. But you're sparing yourself the anxiety, the false alarms, and the potential for treatments you might not need. A great question for your doctor is this: based on my overall health and life expectancy, am I more likely to benefit from continuing mammograms? Or am I more likely to experience harm from overdiagnosis and unnecessary treatment? You can also ask what signs or symptoms you should watch for at home, and when you should come in for evaluation outside of routine screening. Prostate cancer screening with the PSA test is another area where the guidelines have shifted dramatically, and many men over 70 are still getting annual PSA tests without understanding the trade-offs. The PSA test measures a protein in the blood that can be elevated in prostate cancer, but it's also elevated in benign conditions like an enlarged prostate, infection, or even after certain activities. The problem is that most prostate cancers grow very slowly, especially in older men, and many will never cause symptoms or shorten life. But when a PSA test comes back high, it sets off a chain reaction. You're sent for a biopsy, which is uncomfortable and carries risks of infection, bleeding, and pain. If cancer is found, even a low-grade, slow-growing cancer, there's enormous pressure to treat it with surgery, radiation, or hormone therapy, and all of those treatments have serious side effects that can destroy your quality of life. Incontinence, impotence, bowel problems, fatigue, these are real, life-altering consequences, and for many men, the cancer would never have caused a problem in the first place. The United States Preventive Services Task Force says that PSA screening for prostate cancer should be a shared decision, and for men over 70, the recommendation is generally against routine screening. The harms outweigh the benefits for most men in this age group. The key question is not whether you have prostate cancer, because many men over 70 do have slow-growing cancer cells in their prostate, but whether finding and treating it will improve your life or just make it harder. If you're 75 with heart disease and diabetes, aggressive treatment for a cancer that might take 15 years to become dangerous doesn't make sense. On the other hand, if you're 70, very healthy, have a strong family history of aggressive prostate cancer, or you have new urinary symptoms that concern you, then a conversation about PSA testing might be appropriate. The key is to ask your doctor what would happen if the PSA is elevated. Walk through the next steps, the risks, the benefits, and the impact on your day-to-day life. Make a decision that honors your values and your goals, not just a number on a lab report. Advanced imaging for minor back pain is the fourth test on our list, and this is one that surprises a lot of people because it seems harmless. Back pain is incredibly common after 70. Arthritis, disc changes, muscle strain, these are normal parts of aging, and most back pain improves on its own with time, gentle movement, and conservative care. But too often a patient mentions back pain, and the doctor immediately orders an MRI or a CT scan, and that's where the trouble starts. These scans are very sensitive, and they will almost always show something. Bulging discs, bone spurs, arthritis, narrowing of the spinal canal, the list goes on, and every single finding creates fear and pressure to do something about it. The problem is that many of these findings are normal age-related changes that don't correlate with pain, and seeing them on a scan can create anxiety and a push toward treatments that may not help. You might be sent to a surgeon who recommends spinal fusion. You might undergo injections, nerve blocks, or other procedures, all with risks and side effects, when the original pain might have resolved with physical therapy and patience. Multiple studies have shown that for uncomplicated low back pain without red flag symptoms, early imaging doesn't improve outcomes and often leads to more procedures and worse results. The red flags to watch for are things like severe or worsening pain, new numbness or weakness in your legs, loss of bowel or bladder control, unexplained weight loss, or a history of cancer. If you have any of those, imaging is absolutely appropriate and you should get it right away. But if your back hurts after gardening, or you woke up stiff one morning, or you have chronic stable arthritis pain, an MRI probably isn't going to change your treatment plan. Instead, focus on physical therapy, gentle strengthening, heat or ice, anti-inflammatory medications if appropriate, and giving your body time to heal. Ask your doctor this: what red flag symptoms should I watch for that would make imaging necessary? And if we do get an MRI, how will the results actually change my treatment plan? The fifth test we need to talk about is routine whole-body CT scans or low-dose lung CT scans in people without significant risk factors. These are often marketed as preventive or peace-of-mind scans, and they sound appealing. Who wouldn't want to catch something early? But the reality is that these scans expose you to radiation, and more importantly, they find a lot of things that look abnormal but aren't dangerous. Small nodules in the lungs, cysts in the kidneys, spots on the liver. These are called incidental findings, and they're incredibly common in older adults. Once something is found, you're caught in a cycle of follow-up scans, biopsies, specialist visits, and worry, often for findings that would never have caused symptoms or harm. This is the medical equivalent of opening Pandora's box, and most people regret it once they're stuck in the system. Lung cancer screening with low-dose CT is recommended for people aged 55 to 80 who have a significant smoking history, at least 30-pack years, and who currently smoke or quit within the past 15 years. If that's you, talk to your doctor about whether screening makes sense. But if you're 75, never smoked, and someone is offering you a whole-body scan just to check everything, that's not evidence-based medicine. That's a recipe for overdiagnosis, overtreatment, and a lot of unnecessary stress. Now let's talk about what all of this means for you and how to take control of these decisions, because knowledge without action is just information. First, understand that saying no to a test is not the same as giving up on your health. It's actually a form of taking charge, of setting priorities, and of protecting your quality of life. You have the right to ask questions, to weigh risks and benefits, and to make decisions that align with your values. If a doctor orders a test and you're not sure why, ask, what are we looking for? What will we do differently if the test is positive? What are the risks of the test itself? What happens if I choose not to do it? Second, recognize that after 70, the goal of medicine shifts. It's no longer just about preventing disease or finding problems early. It's about maximizing function, comfort, independence, and joy. And that requires a completely different approach than what worked in your 50s and 60s. Some of the healthiest, happiest seniors I know are the ones who have fewer doctor appointments, fewer medications, fewer tests, and more time doing the things they love. They've learned to trust their bodies, to focus on what matters, and to say no to the medical assembly line when it doesn't serve them. That's the kind of empowered aging I want for you. Third, remember that every person is different, and these guidelines are just that, guidelines. Your family history, your personal risk factors, your overall health, and your life expectancy all play a role in what makes sense for you. Medicine should be personalized, thoughtful, and respectful of where you are in your life, not a one-size-fits-all checklist handed out at every appointment. Now let's talk about some practical alternatives to these tests that can give you peace of mind without the risks. For colon cancer, if you've had normal screenings and you're not comfortable with another colonoscopy, ask about stool-based tests like FIT or Cologuard. They're not perfect, but they're non-invasive. You can do them at home, and they can catch warning signs without the prep and procedure. For breast health, continue doing self-exams. Know what's normal for your body, and report any changes like lumps, dimpling, nipple discharge, or pain that doesn't go away. For prostate health, pay attention to urinary symptoms. Talk to your doctor if things change, and don't let a number on a blood test dictate your life. For back pain, focus on movement, physical therapy, strength training for your core, and managing inflammation through diet and lifestyle. I also want to give you a simple 7-day reflection plan that will help you process this information and prepare for your next medical appointment. On day 1, write down all the routine tests you've been having. On day 2, for each test, note when you last had it, what the results were, and whether you've had symptoms or concerns since then. On day 3, reflect on how those tests made you feel. Did they give you peace of mind, or did they cause anxiety, discomfort, or led to follow-up procedures you didn't expect? On day 4, think about your overall health goals. What matters most to you? Independence, comfort, time with family, staying active? On day 5, write down 3 questions you want to ask your doctor at your next visit using the examples I've given throughout this video. On day 6, talk to a family member or trusted friend about your thoughts. On day 7, commit to one action, whether it's scheduling a conversation with your doctor, declining a test that doesn't feel right, or simply giving yourself permission to take a more thoughtful approach to your medical care. After these 7 days, come back and leave a comment. Tell me, did this change what you'll ask your doctor at your next checkup? Your experiences help other viewers feel less alone, and I read every single comment because your voice matters in this conversation. I also want to be very clear about when you should never refuse or delay a test. If you have new symptoms, things are changing, or something feels wrong, always talk to your doctor right away. Unexplained weight loss, blood in your stool or urine, a lump that wasn't there before, persistent pain that's getting worse, new confusion, weakness, or trouble breathing. These are not things to ignore or wait out. The goal is not to avoid all medical care. The goal is to avoid unnecessary, low-value tests that create more harm than help when you're feeling fine and have no symptoms. There's a big difference between screening, which is testing people who feel well, and diagnostic testing, which is investigating a problem. And understanding that difference will change how you approach every doctor's appointment from now on. Let's also talk about how to have these conversations with your doctor in a way that's respectful, collaborative, and effective. Start by expressing appreciation for their care and acknowledging that you know they want what's best for you. Then say something like, "I've been reading about screening tests after age 70, and I'd like to talk about whether all the tests I'm currently getting still make sense for me." Most doctors will respond well to thoughtful questions and a genuine desire to be involved in your care. If they seem defensive or dismissive, stay calm and ask specific questions. What is my individual risk? What would happen if we watched and waited? Are there less invasive options we could try first? If they still won't engage, it might be time to find a provider who values shared decision-making. It's also worth talking about the concept of medical autonomy and why it matters so much after 70. For most of your life, you've made your own decisions. You've raised families, built careers, managed households, and navigated challenges. You deserve the same respect and autonomy in your medical care, and you should never feel like a passive recipient of orders from someone who barely knows you. Too often, older adults are treated as if they should just follow instructions without question, as if their experience and wisdom count for nothing. That's wrong. You know your body better than anyone. You know what you can tolerate, what matters to you, and what doesn't. And you need to bring that knowledge into the exam room and expect to be heard. Another important concept is the idea of less is more in geriatric medicine. There's a growing movement among doctors who specialize in older adults to focus on deprescribing unnecessary medications, reducing low-value tests, and prioritizing quality of life over quantity of interventions. This isn't about giving up or being nihilistic. It's about being smart, evidence-based, and person-centered, and the research supports this approach completely. Studies show that older adults who have fewer medications, fewer tests, and fewer specialist visits often do better, not worse. They have fewer side effects, fewer hospitalizations, less confusion, and more energy to focus on living well. This is the approach I try to bring to every patient conversation, and it's the approach I hope you'll bring to your own care starting today. Now let's talk about what this means for your family members and caregivers. Because if you're an adult child watching this video on behalf of an aging parent, you play a crucial role. Your job is not to take over or make decisions for them. unless they're unable to make decisions themselves, but to support, advocate, and help them ask the right questions. Go to appointments with them if they want you there. Take notes. Ask the questions they might forget to ask. Respect their autonomy and their wishes, even if you would make a different choice. And if you see a doctor pushing a test that doesn't seem to make sense given your parents' overall health, speak up gently and ask for clarification. Sometimes just having another person in the room asking questions can shift the dynamic and lead to better, more thoughtful care. Let's also address the fear that many people feel when they consider refusing a test. What if I refuse a colonoscopy and then develop colon cancer? What if I stop mammograms and miss something? These are real fears, and they're understandable. But here's the truth nobody wants to say out loud. There are no guarantees in medicine. You can do every test, follow every guideline, and still develop cancer or another serious illness. Or you can skip tests that don't make sense for you. Live your life fully and never have a problem. The goal is not to eliminate all risk, which is impossible, but to make informed choices that balance risk, benefit, and quality of life in a way that honors who you are. The key is to stay informed, stay engaged with your body, report symptoms when they arise, and trust that you and your doctor can navigate whatever comes up. Refusing a low-value screening test is not the same as ignoring your health. It's choosing to focus your energy and your medical care on the things that truly matter, and that's a form of wisdom that only comes with age and experience. I want to close by reminding you of the main takeaways from today's conversation. After 70, many routine screening tests may carry more risk than benefit, especially if you've been screened regularly, have no symptoms, and have other health concerns that affect your life expectancy or your ability to tolerate treatment. The 5 tests we talked about today are not bad tests, but they may not be right for everyone in this age group, and it's your job to ask questions and make decisions that align with your values. Bring specific questions to your next appointment. Talk openly with your doctor. Focus on quality of life, not just numbers on a lab report. And remember that saying no to a test is not giving up. It's taking charge of your health in the most meaningful way possible. If this video gave you clarity, confidence, or peace of mind, I'd be so grateful if you'd subscribe to Dr. Adriana Senior Health. I'm here to give you the information, the questions, and the support you need to navigate your health with wisdom and dignity. Share this with a family member or friend who might be facing these decisions, and leave a comment letting me know what resonated with you or what questions you still have. Thank you for trusting me with this important conversation, and remember, your health, your choices, your life.